Order. Irene Campbell to move the motion.
I beg to move that this House has considered E-petition 705-384 relating to the use of dogs in scientific and regulatory procedures. It is a pleasure to serve under your chairship, Ms Jardine. I would like to begin by declaring an interest, as I am chair of the APPG on phasing out animal experiments in medical research, and I'm keen to ensure that this is achieved sooner rather than later. The petition is named Ban Immediately the Use of Dogs in Scientific and Regulatory Procedures. It was created by Maria Iriart and as of today has almost 236,000 signatures, which is an incredible achievement. And Maria is here today, so thank you for coming along. The petition goes on to say, as a first step to end animal testing, we want an immediate ban for dogs. They are commercially bred in what we see as bleak and inhumane factory-like conditions. We believe there is evidence suggesting that dogs are left being unattended for extended periods in a government licensed establishment. In 2023, 2,456 dogs were used in 3,749 scientific procedures. 734 of those procedures were classified as causing severe or moderate harm. There were 2,593 procedures for regulatory purposes, even though there is no UK legislation that mandates animal testing. These procedures can include oral gavage, where a tube is inserted into the dog's throat up to 3 times a day to administer liquids to the stomach. There are studies questioning the reliability and human relevant value of the outcomes of these tests. When looking at Hansard for other debates on animal testing, and particularly testing on dogs, I found an interesting starting point in the Protection of Dogs Bill of 1927 during a debate in the other place. In that debate from almost a century ago, Lord Banbury quoted the eminent surgeon, Sir Lambert Ormsby, who said, "Experiments on dogs may now be discontinued. All that can be found out by physiological experiments for application to human beings has long since been discovered, and repetitions are unnecessary and cruel." And yet here we are, nearly 100 years later, discussing the very same issue. An opinion poll conducted for the UK government by Mori in 2018 found that only 14% of the UK public feel it is acceptable to use dogs for medical research to benefit people. This is unsurprising, as we know dogs have high emotional and intellectual capabilities, and studies have found that they can feel empathy, sense sadness or fear, and demonstrate genuine human bonding. The UK Home Office regulator is intended to conduct assessments of the compliance of all licence holders, which includes on-site inspections and enforces standards for the care and accommodation of all animals bred, supplied or used for scientific purposes. And to enforce the regulations, establishments are required to have dedicated individuals, including vets with legal responsibilities for the care and welfare of animals, as well as an ethical review body. The Government responded on the 5th of March 2025 to clarify they do not agree to immediately ban the use of dogs for testing and research purposes in the UK. However, hopefully this debate will reignite that discussion and any subsequent decisions.
Will my honourable friend give way?
I will give way.
I'm very grateful to my honourable friend for giving way. I was visited by a constituent named Clara. She raised this issue to my attention. I was keen to come and hear and participate in the debate today. She's made 2 really important points. One is that this process has no legislative basis, and it also has no public consent. And so I hope that when the government listens to this debate today, we can look at how to take action to make sure that man's best friend is left alone as man's best friend.
Yeah, I thank my honourable friend for that intervention, and I absolutely agree with everything you said. So it's important to note that the Labour Manifesto pledge commits the government to partner with scientists, industry and civil society to phase out animals in medical testing, stating that this is a long-term goal, which will need further scientific and technical advancement and validation to reach this point. The group Understanding Animal Research support the use of animal research currently in the UK. They say that in the UK, dogs are primarily used to find out how new drugs act within a whole living body and whether new medicines are safe enough to test in humans. Their genome has been sequenced, and so they are often used in genetic studies. Dogs are primarily used in regulatory research and as a secondary species alongside rodents. The dogs are mostly tested for areas including Duchenne muscular dystrophy, anti-rabies vaccines, heart research and veterinary medicine. They state that research dogs live in large enclosures together with their pack mates. Lab technicians look after the dogs and play with them every day. The dogs are fed and watered daily, and the environment, lights, temperature, etc. is controlled automatically. They say that the cages are cleaned daily and the space is big enough to have a toilet area separate from the bed and play area. Dogs are intelligent enough to keep these areas separate, and there's plenty of space to allow them to do so. Because the dogs live together, their social needs are met by other dogs. Unlike pets, they do not require the constant company of humans. However, Animal Free Research UK disputes this quality of care. They say that applications for project licences to conduct animal experiments are very rarely refused, and answers to written questions submitted in Parliament indicate that over the past 7 years, only one licence has ever been rejected.
Would my honourable friend give way on that?
I will give way.
I thank my honourable friend for giving way and for making a powerful speech. I met Nutmeg this morning, a lovely beagle, which she recognised a large proportion of the dogs that are undergo medical scientific procedures are beagles. I believe it was 3,565 out of 3,770. And does she also agree with me that if the government won't commit right now to an immediate ban, that at least we have a clear time frame for when such a ban may come into place?
Yeah, I thank my honourable friend, and I agree with everything that you've said, that my honourable friend said. So, applicants are allowed to adjust and resubmit licence applications to enable them to be granted. And so, for the last 4 years, some applications actually had a mean number of 2.55 iterations before they were granted. The Animals and Science Regulation Unit's annual report for 2023 stated that there were 169 cases of non-compliance with the law or with licence conditions. This was only a 3% decrease from 2022. These involved a total of 154,904 animals, representing an overwhelming 864% increase on 2022. Beagles were used in a study conducted by AstraZeneca to test a new, more eco-friendly propellant for use in inhalers. The test lasted up to 39 weeks and involved 72 beagles. The dogs were restrained by a tether and forced to inhale the gas for 2 hours each day through a mask fitted over their nose and mouth, held in place by a muzzle. Although the study states that the dogs had freely available access to water, it also states that water was withheld during the tests and for 16 hours overnight. This meant that dogs went without water for at least 18 hours each day, and at the end of the study, all the dogs were killed so that their tissues could be dissected for further study. The authors noted that the inhalers contribute only a small fraction of global HFA emissions, and really we have to ask, was this treatment of these dogs in this way really justified? In 2017, the Home Office released figures showing that 1.81 million additional animals were bred and not used for scientific procedures in Britain. However, we haven't had any additional data since, and the above-mentioned 1.8 million animals who were bred and not used included 97 beagles, and we have no idea what happened to the animals that were not used. Yes, I will give way.
I thank my honourable friend for giving way. We are a nation of dog lovers, of animal lovers. Does she agree with me that there is widespread public support for setting out a roadmap to ending the use of animal testing, so that the very sad stories she's describing today can be left in the history books where they belong?
I thank my honourable friend for his intervention, and again, I fully agree with everything you've said, and I really hope I'm going to speak a little bit about that later on, and I fully agree with everything that has been said. So, modern non-animal methods give the best possible chance of securing medical progress, since they're not hampered by translating from one species to another. An estimated 92% of drugs fail in human clinical trials, even though they have passed preclinical tests, including animal tests. Just over 30% of those that do pass are subsequently relabelled with warnings of side effects not predicted by animal tests, and almost 10% are completely withdrawn from the market. So, new non-animal methods based directly on human biology include the use of computer modelling and organ-on-a-chip technology, which can be much more relevant to the human body. And I went on a lab trip recently with the APPG on phasing out animal experiments in medical research to visit the Animal Replacement Centre of Excellence at Queen Mary University of London, and saw in person the pioneering work that is being done to provide medical breakthroughs without the use of animals. I will give way.
I thank my honourable friend for giving way on that point. Would you agree with me that there is a bit of a disconnect at the moment between the scientific possibility in terms of non-animal alternatives and what's actually happening in the ground, in the sense that for decades now we've had suggestions of ways that we can use non-animal alternatives, and yet we're not doing that? And would you commend the work of Cruelty Free International, who are actually producing a new list that explains exactly how you can switch from one type of experiments to the others tomorrow?
I thank my honourable friend for her intervention, and I fully agree with everything that you've said and that the honourable member said, and I'll speak about that in a minute. So, a study published in Nature Communications Medicine found that the non-animal liver on a chip device was able to correctly identify 87% of drugs that carried a risk of liver toxicity in humans, despite these drugs having passed through animal safety tests. Another example is research at Edge Hill University, where scientists are developing a human cell model of the blood-brain barrier to study the link between irregular heartbeat and an increased risk of brain damage, stroke and dementia. Normally, large animals like dogs would be used to study heart disease, and so this work will be much more relevant to patients and provides a real case to phase out testing on dogs. Comprehensive analysis from a paper authored by Dr. Jared Bailey found that dogs are highly consistent predictors of toxic responses in humans, and that the predictions they can provide are little better than those that could be obtained by chance or tossing a coin when considering whether or not a compound should proceed to testing on humans. And one simple example of this is food like grapes and chocolate being poisonous to dogs, and some drugs that are safe for humans, like ibuprofen, are highly toxic to dogs, even in small doses. Animals are used in research because of their genetic similarity to humans, yet while we share up to 98% of our DNA with some animals, it's the small yet important differences that make us distinct. There are many historical examples of deadly drugs which appeared safe in animal tests. Thalidomide was tested safely with animals but caused severe birth defects in thousands of babies. Similarly, Vioxx was a painkiller which was linked to thousands of heart attacks and deaths, despite cardioprotective results obtained in animal tests, including in dogs. The current approach to alternatives from animal testing is to fund the development and dissemination of techniques that replace, reduce and refine the use of animals in research, more commonly known as the 3 Rs. Yet there is little funding, in relation to the point made earlier, for non-animal methods, as the APPG on human relevant science estimated that human relevant non-animal method funding represents between 0.2% and 0.6% of total biomedical research funding in the UK and 0.02% of the total public expenditure on research and development. So, I will give way.
Thank you for giving way. And on that point, I think the previous government actually committed to doubling investment in this area. Is that something that, like me, she would welcome the current government at least matching, if not improving?
My honourable friend for his intervention, and I fully agree with everything that he has said. So, surely we must consider reversing our priorities, and this debate provides us with the prime opportunity to look at how we can fund future testing in the UK. In 2023, the Department of Health and Social Care confirmed that there is no United Kingdom legislation that mandates animal testing. The regulatory guidelines do recommend that new drugs are tested on 2 species before moving to human trials, but in 2023, the Department of Health and Social Care also stated that assessors will accept data from a suitably validated model that has been demonstrated to be predictive in lieu of animal data. So it is possible. In 2023, almost all regulatory tests in dogs were carried out to satisfy EU requirements, with only 12 regulatory tests in dogs being carried out to satisfy UK-only requirements. Cruelty Free International reports that animal tests continue to be commonly used, even when validated alternatives exist. In the USA, the Food and Drug Administration, the FDA, has released a new roadmap to reduce and replace animal testing in drug development and regulation, following the 2022 decision by US Congress to pass the FDA Modernisation Act, which facilitates the use of non-animal methods for drug testing. And recently, on the 10th of April, the FDA announced they are beginning to phase out animal testing for monoclonal antibody therapies, which is to ultimately be followed by other drugs. Canada, Australia and other countries within the European Union have all come up with roadmaps for ending animal testing, and it really is high time for the UK to join them. For the government to stop issuing licences for experiments using dogs, there must be a thorough overhaul of the licensing of animal experiments to really ensure that the basic legal requirements to use non-animal methods, wherever possible, are being properly enforced. Ending the use of dogs can be the first step in full transition to the cutting-edge, human-specific methods that offer the best possible chance of advancing medical progress. And as I close my opening remarks, I'd like to mention the Radio 4 Today programme from this morning, where Understanding Animal Research and Cruelty Free International were discussing that this debate was taking place. And one question that was asked during this interview was about what happens to dogs after the research. It was confirmed that they are euthanised and dissected to look at their lived experience. And strangely, after this hard-hitting discussion on the lives of laboratory dogs in the Today interview, just after the 9 a.m. news, the announcer advised that the programme coming up at 9:45, called Wheels and Woofs, would look at disabled dogs living their best lives. Something that a laboratory dog will never get to do. And I'm looking forward to hearing from other members and the Minister's comments.
Can I remind members that they should bob if they wish to be called in the debate? The question is that this House has considered E-petition 705384 relating to the use of dogs in scientific and regulatory procedures. John Mill.
Thank you. And it's a pleasure to serve under your chairmanship today. And thank you for bringing this very important debate. Every year, thousands of dogs are subjected to scientific experiments in the UK, often in the name of drug development. For many, this raises serious ethical questions about the use of animals for human gain. Is an animal suffering worth the benefits to scientific discovery? For others, science and not the animals are paramount. The end justifies the means, as it were. However, animal testing doesn't deliver us robust and useful scientific data. In fact, drug research on dogs tells us very little about whether a drug will work for humans at all. And so, campaigners argue, it is time to end animal research. Dr. Jared Bailey, a geneticist, has put it plainly. Different species react differently to diseases and treatments. In other words, what works in dogs may not work in humans. In fact, drugs that pass animal tests fail in human trials 92% of the time, a staggering and indeed costly statistic. If we take toxicity testing, even when dogs show no toxic response, it barely improves our confidence that the drug will be safe in humans. It improves it from just 70% to just 72%, barely noticeable. Is that really a sound basis for human medicine? Fortunately, science does offer us a better path forward. Human-specific technologies, such as organ chips, are revolutionising drug development. These miniaturised organs mimic how real human organs react to treatments and can be patient-specific. They've shown 87% accuracy in detecting drug-induced liver toxicity, a dramatic improvement over animal models. If adopted widely, these tools could create over $24 billion through research and development in the US. The US Food and Drug Administration has recognised this, and through the FDA Modernisation Act 2, the agency has removed the legal requirement for animal testing in drug trials. A third act is already in the works to accelerate the validation and adoption of human-specific methods, such as organ chips. However, in the UK, we're lagging behind, not because of legal barriers, but perhaps due to entrenched industry habits, possibly financial interests, and even cultural resistance within the research community. But we can change this, gradually, responsibly, and strategically. I'm calling for a phased approach to end the use of dogs in UK research. This means increased investment in modern, human-relevant alternatives and a national commitment to shifting away from outdated animal models. When the practice of animal testing is scientifically flawed, it is also undeniably ethically indefensible. Animal suffering for unreliable and inapplicable data cannot be justified when we have the tools and knowledge to do better. Let the UK be leaders, not followers, in creating a more humane and effective future for our scientific research. Thank you.
Steve Race.
Thank you, Mr. Chairship, and I thank my honourable friend, the member for North Ayrshire and Arran, for introducing this Petitions Day, and also the 478 extra constituency residents who've signed the petition to support this important topic. I'm speaking today in support of phasing out the use of dogs in medical research because the scientific case for change is now overwhelming. Members may know that I've got a private member's bill on phasing out the use of animals in medical research, and so I very much support this petition. That private member's bill is the first time that any bill of this kind has been laid before Parliament, and I'm very proud to be bringing this to the House. I approach this topic from a position of scientific rigour, and it's clear from the use of animals in medical research that it does not necessarily offer the best scientific basis for medicines testing. According to Animal Free Research UK, as already mentioned, over 92% of drugs that pass animal tests, including tests on dogs, go on to fail in human trials. That's an extraordinary figure. It means animal testing, far from protecting human health, is actually giving us a false sense of security and can slow down medicine's development. This is inefficient and it's generating bad science. These animal trials often fail to identify side effects in humans, for example. And dogs, while closer to humans than rodents, are still fundamentally different from us in key biological ways. And comprehensive analysis has found that dogs are highly inconsistent predicators of toxic responses in humans, and it can be no better than tossing a coin. Crucially, there's no law saying we must do this. As already been mentioned, the Department of Health and Social Care confirmed in 2023 that while international guidelines suggest testing on 2 species, including dogs, is not a legal requirement, we continue largely out of habit, not necessity. And indeed, when I questioned some of our larger pharmacos about whether they have a strategy for reducing the use of animal testing and animal experimentation overall, some of them have said, no, there is no strategy, but they do have some principles. So it's clear that the government does need to act in this space. We do have better options. Cutting-edge methods like organ-on-a-chip technology, 3D human tissue models, supplemented by the use of AI-enabled modelling, are far more accurate, predicting how drugs will behave in people. Investing in these technologies would make drug development faster, safer, and ultimately far more effective. I've seen for myself how these techniques can be applied to science. In Exeter, we have a Centre for Excellence of Animal-Free Research at our Research, Innovation and Learning Development Centre, jointly operated by a hospital trust and the University of Exeter. And these researchers excel in using animal-free methods in scientific exploration, specifically in some cases into cell aging, which has already generated several startup companies out of that centre. So this is cutting-edge science, exactly where we ought to be as a country. Investing in these areas of science instead of relying on old methods involving millions of animals every year will mean that the UK can lead the world in this area of scientific innovation. Indeed, the UK may already be falling behind internationally on this issue, which is a travesty when you think about it for a nation of animal lovers. In April, the US FDA, as mentioned, announced that it would move away from animal testing in the development of monoclonal antibody therapies and other drugs to replace with, and I quote, more effective human-relevant methods. The FDA goes on to say that this new approach is designed to improve drug safety, accelerate the evaluation process, while reducing animal experimentation, lowering research and development costs, and ultimately drug prices. One of the reasons the FDA states it has made this move is to provide global leadership in regulatory science, in which it reaffirms its role as a global leader in modern regulatory science, setting new standards for the industry and encouraging the adoption of innovative, humane testing methods. So there you go. If the US can move in this direction, it's imperative that the UK does so too. Our life sciences sector simply should not be left behind in cutting-edge science. My private member's bill is based on the Campaign for Herbies law, which offers a clear, responsible plan to phase out the use of dogs and other animals over the next decade. It's a measured step, but a vital one toward a future where science serves both human health and humane values. I'd like to end, Mr Chairman, by commending the Science Minister, Lord Valence, for meeting with me and others to set out his work in this area, and particularly the ongoing development of a strategy document I understand is set to be published soon that will set out a roadmap for phasing out animal testing in medical research where possible. This strategy is long overdue and is evidence that this Labour government, I hope, does take this issue seriously. So, Mr Jardine, I encourage the Minister and the government to choose progress. Let's choose science that actually works for patients, for innovation and for compassion. Thank you so much.
Seamus Logan.
Thank you, Chair, and it's a pleasure to serve under you. And I thank the petitioners for bringing this important debate, and the Honourable Member for North Ayrshire and Arran for her excellent opening remarks. I'm delighted to see so many members of our party here to support her. I rise as a member of an opposition party, but as a member of the APPG in full support of her position today. I regret, apart from the Shadow Minister, there doesn't appear to be anyone from the Conservative Party here. I wouldn't dare suggest they aren't dog lovers. Perhaps they're out walking their dogs on this beautiful day. Now, my wife and I share our home with Lola, our beautiful cockapoo. I say share because I wouldn't dare say that we own her. We share our home. We've just spent Easter ensuring that she didn't make off with any of our chocolate Easter eggs. And I know that's a guilty pleasure of the member for North Ayrshire and Arran. Along with 50% of the families across these islands who have pets, we can readily see the contradiction in medical experimentation on dogs when so many of us understand the love, the intelligence and the friendship that our pet dogs bring to our lives. And yet we seem content to inflict great suffering upon them. Many comprehensive studies, as the Honourable Member for Horsham has already showed us, demonstrate that experiments on animals, including dogs, cannot accurately and fully predict whether new drugs will be safe in humans. And as the member for North Ayrshire and Arran has said, statistics for 2023 tell us that 3,749 procedures were conducted on dogs in laboratories, 69% of which were to test the safety of products and devices for human medicine, dentistry and veterinary medicine. However, with a huge question mark over these tests in terms of reliability and human relevance on the value of their outcomes, it's understandable that there is massive support for the banning of experimentation on dogs in the UK. And in fact, not a month goes by that my inbox doesn't have emails on that topic. Now, the current government, the Labour government, have confirmed that they aim to phase out animal testing, as I understand it, and will publish proposals later this year, I believe. But they are not committing to an immediate ban on the use of dogs, as this petition has called for. And I will be interested to hear what the Minister has to say on this topic in her closing remarks. There is some exciting, no, amazing work happening in the UK in this field, which needs to be supported and celebrated. As a member of the APPG on phasing out animal experiments in medical research, we recently visited the Animal Free Research UK's Animal Replacement Centre of Excellence at the Blizzard Institute at Queen Mary University of London to learn more about their groundbreaking work into how cancer spreads using animal-free methods. At this visit, doctors showed us how they are revolutionising human skin testing, which is already providing better results for patients without using animals, as well as the development of animal-free next-generation 3D tissues and disease models for use in biomedical research. In other words, they grow the tissue in the lab, and they don't need to use dogs. Other truly transformative animal-free methods are available, for example, using computer modelling, which can provide results directly relevant to humans. Now, Herbie's Law, as recommended by Animal Free Research UK, argues for a decade of change and would mandate the replacement of animals in medical research in the UK by 2035, replacing them with humane, effective alternatives. And we know there is support for this from within the Labour Party, largely thanks to the Honourable Member for Exeter and his private member's bill. When the UK government says they are partnering with scientists, industry and civic society on working towards phasing out animal testing, I hope they will also consult with animal protection groups on this goal. They have also agreed to publish an alternative method strategy to support phasing out animal testing, and I hope they will read up on Herbie's Law in this process ahead of their publication later this year. However, I would argue that if the government goal is to be a forefront of an alternative methods revolution, bringing in a commitment to a ban on experiments on dogs would send a clear signal of intent and a major milestone on the important phasing out of animal testing. This does not need to happen within 10 years, as I've said, or even 5 years. This government could commit to the full implementation of Herbie's Law by the end of this Parliament. Thank you, Chair.
Will Stone.
Thank you, Ms Jardine. It is an honour to serve under your chairship, and thank you to all the people here who have put forward the petition. I would also like to thank the people of Swindon North who have signed it, and the other growing number of citizens across the UK who believe that dogs shouldn't be used in science. We are a country of animal lovers. We love our dogs. we are going past the point where they should be used for experiments. Whilst there may be some that argue that dogs have a similar biology to humans, it still doesn't guarantee accurate data. Putting it simply, it is not worth the risk. Dogs don't have their own voice, so it is up for us to speak for them. I would personally like to see a future using AI technologies like organ-on-chips that can mimic structures and functions of human tissues or organs in the lab and vital models that are changing how we do medical research. They are already helping to reduce the number of needs for animals in testing, and in some cases, starting to replace them fully. AI systems now allow researchers to track animal behavior more precisely, which is reducing the number of animals required to extract more meaningful data. In the United States, the FDA has already began phasing out animal testing and replacing it with more human, relevant models like AI-driven toxicity screening and organoids. I kind of think it's a rule of thumb if the United States is starting to do better in animal welfare than us, we probably need to take a hard look in the mirror because something has gone wrong. The UK cannot afford to fall behind on this. We have a chance to be a world leader. We have a chance to excel in AI and boom off its growth. Current AI technologies still require trials, though, and testing before they can be officially approved. However, when health and the lives of dogs are on the line, is it really fair to only use potential data to make it more accurate? The opportunity for the UK to lead in this field and become a global leader is immense. There is no reason, as the government, we should not be putting forward and progressing for this progress. I know our government is keen, and I know Labour are keen to accelerate the adoption of non-testing on animal methods. And this debate is exactly the mechanism to push it forward. So once again, I thank all the people that have put forward this petition. I thank the numbers who have signed it. And I hope the government listen and start to put an end to phasing out the use of testing on dogs. Thank you all.
Here.
Danny Chambers.
Thank you, Chair. It is an honour to serve under your chairmanship. And I'd like to thank everyone who signed this petition. I know it's a huge achievement to get a debate here in Parliament. And particularly one of my friends, Steph Jones-Giles, who has been a passionate campaigner for animal-free research for years now, and she's been contacting me for years about this issue specifically. I have a dog, well, we have a dog, my partner Emma and I have a dog called Frank. He's quite an unusual looking dog. He's a pug cross border terrier, and he is 15 years old today. And I've had an update of him in Pets at Home choosing his new toy. And thankfully, in 15 years, he hasn't worked out that I'm a vet, because he, he hates going to the vet, and he has no idea. I should probably put up Jenny, who's here today, the guide dog for the member for Torbay. She had her 6th birthday just last week. My reason for bringing this up is that no one thinks it's stupid to celebrate your dog's birthday, because we know that they have the same range of emotions that people do. We also know that they are, well, I was going to say hugely intelligent. You haven't met Frank. They are relatively intelligent. But certainly we know that they feel pain, and we also know that they need to have social interaction, just like us, and they also need to have the freedom to express natural behaviour.
Would he give way on that point?
Yes, absolutely.
I thank my honourable friend for giving way. Like him, I share a love of dogs, and I have a nearly 17-year-old terrier at home, slightly better looking than Frank, I might add. But the level of public interest in this petition is vast. Many of my constituents in Glastonbury and Somerton also have spoken to me very strongly about it, and it shows the strength of feeling on this issue. So does the honourable member agree with me that the transposition of the principle of animal sentience into British law is an essential step to ensuring that the UK retains the highest animal welfare standards in the future?
I thank my honourable friend for making that intervention, because that is a hugely important point. It was going to be my next point, but it's completely accurate that when the veterinary profession has been extremely concerned at the lack of recognition of animal sentience in law, and we would really urge the government to look into changing that as soon as possible. you said Frank was ugly.
I didn't.
I'll happily show. Unique. He's a pug cross-border terrier. He's got, he has got a strange underbite and quite buggy eyes. We were around our friend's house for dinner recently, and one of their children said, "Frank's really ugly," and the other child said, "You shouldn't say that because he might have been in an accident." So. I'd just like to introduce the concept of One Health, which many people have heard of. It's the fact that human and animal health are completely interlinked, whether we're talking about antimicrobial resistance, we're talking about risk of pandemics, we're talking about food security, climate change. And there's also a concept called One Medicine. And this has very much been driven forward by the Humanimal Trust, based on, primarily by academics at Surrey University Vet School. And what we're really pushing to happen is that not only animal experimentation being reduced, refined, replaced by so many of the methods that have been mentioned by other members today, but also that when these tests are carried out, that both humans and animals can benefit from the information gathered. Now, to give you an example, if a drug passes human trials, so if a drug passes animal trials, it then passes human trials. It still doesn't have a license for the animals, where we know that those drugs worked in those animals. And it is often cost prohibitive for companies to then carry out further trials and produce the body of evidence needed to get the license for the animals. Equally, if it passes animal trials and fails human trials, there should be a quick and easy way that these drugs are then made available for veterinary use, so that those animals that have had to endure the experimentation and suffering get a huge amount of benefit from it as well. I'm very proud that the Liberal Democrats in coalition were involved in stopping the testing of household products on animals. I know it meant a huge amount to the veterinary profession, but also all dog and animal owners. And I would really appreciate a meeting with the Minister, maybe with the Humanimal Trust, maybe with academics from Surrey University Vet School, so we can talk about how we can improve the benefit to animals for drug testing and other types of testing, like medical implants and maybe sort of joint implants that are being carried out anyway, to ensure that companies, academics can, as easy as possible, be able to get licenses for these to be used in animals, so that animals can get the benefit of these as well. Thank you.
Tom Hayes.
Thank you, Ms Jardine. It's a pleasure to speak with you in the chair and to follow the excellent speech of the Honourable Member for North Ayrshire and Arran. I'm honoured to be Bournemouth East's Member of Parliament, representing the issues that matter to my town, and dog welfare is an important issue. Bournemouth is a town of dog lovers. We care deeply about the safety of dogs. As a dog lover, it's upsetting that laboratories across the country experiment on dogs and defend their methods as being in the public interest. It's not in the public interest to harm dogs, and nor is it good science. Animal testing is poor science, plain and simple. We must start treating man's best friend better. As the Labour MP for Bournemouth East, I will always stand up for animals because they don't have a voice, and I will always stand up for dog lovers because they use their voice rightly to promote animal welfare. It's time for change, and that means legislation to end the use of dogs in scientific experiments, and I support Herbie's law. In a time of heated debate, I think we can all agree on one fundamental point. Dogs are brilliant. And with that in mind, we need to be doing more. I want to thank Cara and Linda in Muscliffe, Jane in Folkestone, Vanessa in Southbourne and Kate in Charminster in my constituency for sharing their important views on this issue. As Kate says, every 5 minutes, 5 animals are suffering in experiments in British laboratories where non-animal methods are often cheaper and more reliable. I will happily give way.
I'm grateful, and I wonder if he could add to his thanks list the Professor of Molecular Genetics at the University of Exeter, Professor Lorna Harries, who has really pioneered the alternative approaches that can replace some of the experimental techniques that have been used on dogs in the past.
I thank the Honourable Member for his intervention. I agree with him. Raising the voice of scientific experts in this area is absolutely critical, and I welcome that intervention. I also want to thank everyone who has been in contact about this important issue in my constituency and the 336 constituents who signed the petition. And final thank yous to animal welfare charities like the RSPCA on Richmond Park Road in my constituency and Every Paw Matters, who I've spent time with. In fact, we're such a town of dog lovers that the 110th Mayor, Councillor George Farquhar, and his wife Alison, who have rescued a greyhound Billy, now have Billy as the official non-animal consort of the Mayor. Billy will wear a wrap which says "My human votes Labour" when it's election time, but when he's serving as the non-human consort, he will happily just wear a replica chain. And as a consequence, I think it shows just how much Bournemouth loves dogs. To anyone, that was the right response. To anyone who says we need dog testing, they're wrong. Dogs are most commonly used in secondary species testing. After a test happens to a mouse or a rat, researchers do a secondary test on another species, often a dog. But the industry itself says that secondary species testing is unnecessary. We know that non-animal methods could be much more accurate than using animal experiments. And here I want to commend other leading voices in this field, including local business Lush, who are based in BCP in Poole, and who show the way in which we can do better through science. Lush has never tested on animals since its doors opened in 1995. Lush has funded over £2.7 million in research and science to end animal testing, and Lush has an annual prize to reward scientists and educators who use non-animal methods and contribute to important scientific breakthroughs, truly leading the way. There are things that the government can do in the immediate term and the short term. It's wrong that so few inspectors are looking at 3+ million procedures. The industry is marking its own homework. In the immediate term, we need more inspectors. We need a ban on secondary species testing and exclusive reliance on non-animal research methods. In the short term, we need legislation that fully protects animals. As a nation of animal lovers, we're falling behind. The UK was the first country to create animal protection laws in 1822. We were the first to set up an animal welfare charity, the Society for the Prevention of Cruelty to Animals. And the European Union is moving further and faster away from the UK in tackling these cruel experiments on animals and dogs. We must catch up. No other party has such a strong track record of protecting animals. I'm proud to sit in a tradition which includes Keir Hardie, who died in 1915 carrying a pocket watch bitten by a favourite pit pony, having done much to secure better conditions for pit ponies. And for our Labour government, this should be unfinished business. Labour banned the cruel practice of hunting with dogs. It banned deer hunting and hare coursing, protected pets, livestock and wild animals, combated international trade in animal products from endangered species, brought a ban on the use of veal crates in the UK, banned fur farming, and created the principle of a duty of care to meet welfare needs. Labour made an offence to cause unnecessary suffering, mutilation and animal fighting, and Labour banned cosmetic product testing on animals. We passed the most comprehensive reform of animal welfare law in over a century. The last Labour government stood up for animals, starting with the provision of a right to have pets inside the rented household. We're back on track. But back in power after 14 years, this Labour government could go further. We can truly protect dogs and animals once again. Thank you.
Yeah.
Ruth Jones.
Thank you, Ms Yardine. It's a pleasure to serve under your chairship today. And I also thank the Honourable Member for North Ayrshire and Arran for leading this important debate. Now, 562 of my constituents from Newport West and Isloyn have signed this petition, and I'm pleased to have the opportunity to debate this important issue this afternoon and demonstrate to, especially to the members of the public gallery there, but demonstrate that members here in this place are really listening and working on their behalf. And I'd like to begin by paying tribute to the exceptional animal welfare charities, including but not limited to the RSPCA, Nature Watch Foundation, PETA, Animal Free Research UK, Replacing Animal Research and Cruelty Free International. The vital work they do briefing MPs about key issues and campaigns and providing us with facts and figures equips us to make representations on behalf of animals in this place because, as we know, Ms Jardine, as I always say, we must speak up for animals because they can't speak up for themselves. Now, in 2023, there were a total, as we already heard, of 3,770 uses of dogs in scientific procedures. and I'm deeply concerned about the use and potential suffering of any animal in research and testing, and I firmly believe that the ultimate goal should be the total replacement of all animal experiments with humane alternatives. And I'd like to see a diversion of existing funding, resources and expertise away from animal experiments, and I hope this debate will encourage the consideration of all current uses of animals in science and illustrate the support for achieving faster development and uptake of non-animal technologies. However, as the petition illustrates, the public strength of feeling on this issue is particularly apparent when it comes to dogs, who, as we've already heard from very, honourable members, they are much loved members of their families, whether they're ugly, pretty or whatever. It's really important. I am delighted that this Labour government has committed to working towards phasing out the use of animal testing. Scientific reviews highlight the inability of data from dogs to accurately and consistently predict human response. So with the existence of new and developing cutting-edge technology, we don't need whole-body animal systems to assess chemical and drug safety or advance our scientific knowledge of diseases. The adoption of non-animal technologies would enable rapid development of novel therapeutics and better safety testing data for the protection of human health. Such an approach has the potential to improve efficiency, speed and prediction for humans, whilst cutting costs and reducing, of course, animal suffering. Human-specific approaches such as AI, organ-on-a-chip and computer modelling produce results that are much more relevant to people, as has already been very ably outlined in this debate today. And I, like many others, Ms Jardine, who are more mature maybe, have had the benefit of seeing in this place the demonstration of these technologies actually in events in Parliament. Really, really important that we actually go and see these technologies for ourselves. Of course I will.
Thank you. Thank you for giving way. And I was horrified when I became aware that dogs still could be force-fed pesticides as part of these proposals. Would the member agree with me that it is that what we need from the government today, and I hope we hear from the Minister, is clear dates as to when there will be an end to testing on dogs and testing on all animals? Thank you for giving way.
Thank you, and I thank the honourable member for his intervention. And if he'd only read my speech a little bit further on, I have some specific questions for the Minister, because it's always good to ask specifics. So we know that it's vital that the government produces and executes ambitious roadmaps for accelerating the development and uptake of advanced non-animal technologies and the new approach methodologies. Here in the UK, as we've already heard, we can't afford to fall behind other countries who are already delivering on this. And I'm delighted that my early day motion number 210 on Herbie's Law has 49 signatures from honourable members across the House, and there's still time and space just in case anyone's wondering whether they want to sign it or not. 95% of dogs used in the sort of animal testing procedures that we hear about are beagles. Named after a rescued beagle, Herbie's Law will provide a practical framework for phasing out animal testing over the next decade. I supporting the scientific community with this transition. I also wish my honourable friend, the member for Exeter, well with his bill, which is based on Herbie's Law, and I do congratulate him on his hard work on this campaign. And I look forward to a comprehensive and ambitious plan from the government for delivering this transition, and I'm sure the Minister is looking forward to outlining this as she winds up. The petition that inspired this debate today shows the public strength of feeling on this issue. That's why it's also vital there is complete transparency in the reporting of statistics around the use of animals. Ms Jardine, I will.
Thank you very much. I am advised by my Western Bartonshire constituent Matthew that animals who are bred for and not used in scientific procedures are omitted from Britain's annual statistics about animal testing, including dogs. And that means, if true, we have no real idea how many animals are used for science overall in Britain. It was estimated back in 2017 by the Home Office that an additional 1.8 million animals were bred and then not used, so nearly 50% more than our annual official government figures would suggest. Sadly, apparently these animals either died or were destroyed. So does the honourable member agree with me that the task of moving to a country or a society that doesn't harm dogs and doesn't harm animals will be more difficult without full transparency?
intervention because he's made a vital point there, because it's all about transparency, because at the moment, as he quite rightly said, the government does not routinely provide information about the number of animals bred for use in scientific procedures, but they're not used, and also what happens, as he quite rightly says, what happens to these animals later in their lives. Whilst the EU, we know, currently collects and publishes this important data every 5 years, as he said, the UK has not done so since 2017. So we know that at least a third, and he says nearly a half, of total number of animals used in science, they were bred and not used in Britain. And Nature Watch's Foundation Forgotten Lives campaign seeks to highlight these invisible animals, potentially, as he said, hundreds of thousands who are undisclosed in UK government figures. This sort of information is vital to improve transparency and allow for a more accurate assessment of the actual current impact of science on animals in the UK. Efforts to reduce and ultimately replace the use of animals in scientific procedures will be difficult to measure and evaluate unless statistical data routinely includes all animals used in science. So in closing, I would like to ask the Minister 2 key questions. Number one, when will the government provide a detailed roadmap about the transition to human relevant science as a part of their commitment to phase out animal testing? And number two, when will the government review the current publication of statistics to ensure accuracy and transparency? We know Labour is the party of animal welfare. Legislation to improve the lives of animals has formed a vital part of legacies of past Labour governments, and I look forward to building on this with this government today. Ending the use of dogs must be a first step in the full transition to the cutting-edge, human-specific methods that offer the best possible chance of advancing medical progress. And I look forward to hearing the Minister's response. Thank you.
Alison Taylor.
Thank you, Ms Jardine, and it's a pleasure to serve under your chairmanship. And I would also like to thank my honourable friend, the member for North Ayrshire and Arran, for introducing this topic today. This is an issue that resonates deeply with many people across the country, including in my own constituency of Paisley and Renfrewshire North, where the concern for animal welfare is strong and heartfelt. Dogs hold a deeply special place in British life, and as someone lucky enough to share my home with one, I know the joy they bring, the quiet comfort, the loyalty, the unconditional love. They are more than pets, they are family. In 2023, thousands of dogs were used in the UK for experiments, many subjected to painful and frightening procedures. In some research labs, dogs have tubes pushed down their throats, sometimes 3 times a day, to force-feed them chemicals. It's called a procedure, but to dogs, it's just fear and pain. Using dogs in research isn't just cruel, it's unreliable. Over 90% of drugs that pass animal tests still fail when they reach human trials. They either don't work or they're unsafe. In 2006, a trial in the UK for a new drug meant to treat leukemia and arthritis had already been tested on animals. It had been tested on monkeys and it had not revealed any major side effects. But when it was given to healthy human volunteers, within hours their bodies went into shock. They were left fighting for their lives. They nearly died. This is not just a tragedy, it's a warning. These drugs were tested on animals first, but animal suffering does not prevent human suffering. We can't keep pretending that what happens in a dog's body will predict what happens in ours. Time and again, it doesn't. We need better science. As other honourable members have said, a growing number of experts now call for a shift towards modern, human-relevant methods like organ on a chip, 3D bioprinting and advanced computer modelling. These aren't dreams of the future, these are available now, and Britain should be leading the way. We are a nation known for scientific first, from the discovery of penicillin to mapping the human genomes. We also pride ourselves in being a country of animal lovers. That combination gives us a unique opportunity and a responsibility to lead the world in building a better kind of research. This is not just a fringe concern. It speaks to public values, ethical urgency, and a real chance to build science that's not just cutting edge, but truly humane. The petitioners are looking for better science, kinder choices, and British leadership in shaping a more compassionate future. I welcome this debate. Thank you.
Michelle Scroggin.
Thank you. And it's a pleasure to serve under your chairship. The use of dogs in scientific and regulatory procedures is an issue that rightly draws strong public interest. With over 235,000 people signing the petition on the debate today, it's not just a small outcry, it's a clear signal that action is needed. My much-loved working Cocker Spaniel Charlie, like so many other dogs, is a clear example of how sentient and intelligent dogs truly are. And I'm sure he'd want me to put on the record today that he is a very handsome dog. And I was thrilled to see Jenny enter the room today. The response when a dog enters the chamber in Parliament, you can feel it in the room. They bring more to our lives. Dogs form deep emotional bonds. They show remarkable sensitivity and learn with incredible ease. As with most dogs, Charlie is not just a pet. He's a member of my family, alongside my two cats, Merlo and Jags. I hesitate to add that I didn't name the first one. It's precisely this connection that makes the idea of using dogs like Charlie in laboratory experiments impossible to justify. However, the case should not only be made on ethical and emotional grounds, but also in terms of practicality and scientific validity. A growing body of evidence points to the limited translational value of data from dogs, as we've already heard from many of the members in here today, in predicting human responses to drugs and chemicals. It's particularly concerning when we discover that the pace of innovation in non-animal methods, including organ-on-a-chip technology, advanced cell cultures and AI-driven modelling systems. These approaches are not only more humane, but also frequently more accurate and cost-effective. It begs the question, why haven't we moved on this already? Yet despite advances in biomedical research, dogs continue to be used in procedures that often cause significant suffering. There may be force-fed substances for toxicity tests, restrained for long periods, and ultimately euthanised. And almost every member in here has mentioned that on this debate. These are not minor interventions. They're often serious intrusions on an animal's welfare, and they occur even when the scientific merit of such tests is increasingly being questioned. While the government has stated that commitment to phasing out animal testing when scientifically possible, many would argue that we've already reached that point, and at least in the case of dogs. The infrastructure, the knowledge and the tools exist. What we now need is determination to act on them. I understand that regulatory change takes time, but we must be clear in our direction of travel. The continued use of dogs in research is increasingly difficult to defend in the light of alternatives. Shifting public opinion and our broader responsibilities under the Animal Welfare Act and scientific best practice. We have the opportunity to show leadership on this issue, to support innovation, uphold ethical standards and respond to the concerns of hundreds of thousands of our constituents. It's time to set a clear path towards ending the use of dogs in research and to invest in alternatives that will define a more humane and modern scientific future. Thank you.
Tony Vaughan.
Thank you, Ms Jardine. It's a privilege to serve under your chairship. And I also want to thank and pay tribute to my honourable friend, the member for North Ayrshire, and Aaron for leading this debate and for her masterful analysis of this issue. I also want to thank the petitioner who has raised this critical issue and the over 234,000 people who have signed the petition. This is an issue I care about deeply. I have a dog called Harry. He's a fox red Labrador and he's an integral part of our family. And I thank him for being essentially my personal trainer. He runs far faster than me and keeps me fit. And I agree with everything that others have said about the high intelligence and emotional sensitivity of dogs. Many of my constituents in Folkestone and Hythe are dog lovers and dog owners. We have miles of beautiful coastline to walk dogs along, and 316 of my constituents have signed this petition. I do receive on an ongoing basis many emails from local people who are deeply concerned about dogs and other animals being used in testing. Nationally, the use of dogs in scientific research is relatively rare, accounting for about 0.2% of all animal procedures in Britain. Yet in 2023, almost 2,500 dogs were used in nearly 3,750 scientific procedures, with over 700 classified as causing moderate or severe harm to them. So while regulations are in place which are supposed to protect laboratory animals and advances are being made to reduce and refine their use, there is growing evidence and public sentiment, just as the debate here has shown us, questioning the reliability, the necessity and the ethics of subjecting dogs to such procedures, especially when alternative methods are being developed. And I, like my colleagues, believe that this country should be a world leader in ensuring the highest standards of animal welfare. We're seeing rapid advances in AI, and I'm very pleased to see the AI Minister here to answer this debate, which offers powerful and humane alternatives to animal testing involving dogs. Today, AI-driven methods can analyse vast amounts of biological and chemical data to accurately predict how new drugs and chemicals will behave in the human body. As honourable members have said, these technologies are already being used to identify potential risks and filter out unsafe compounds before they ever reach an animal or a human trial. This approach, the use of this technology, spares countless animals, or would spare countless animals, from unnecessary suffering, but would also accelerate the pace of scientific discovery and reduce costs. By investing in and embracing AI, we have the opportunity to lead the way towards a future where UK science and compassion go hand in hand, and where use of animals in research becomes a thing of the past. I look forward to reading and analysing the publication of the government strategy for developing alternative methods for animal testing, which I believe will be published later this year. I would say that in drawing up that strategy, I would urge the government to engage meaningfully with animal protection groups, such as PETA and others, whose experts have played a key role in developing effective science-led and science-driven policies, so that we may replace experiments on dogs with superior, humane, non-animal testing here in the UK and across the world. Thank you.
Liberal Democrat spokesperson Jamie Stone.
Thank you very much. It is a real pleasure to share under your authority, Ms Jardine. Can I make it clear at the outset, for the avoidance of doubt, that although I am the chair of the Petitions Committee, I'm speaking this afternoon on behalf of my party, and it's a winding up role. And it has been a very thoughtful and impassioned debate. And I think if you ever wonder, do dogs have feelings? Do they have memories? Are they sentient beings? You don't have to go to Edinburgh, and you'll know what I'm talking about, Ms Jardine. If you go to the corner of Candlemaker Row and George IV Bridge, there's a statue of Greyfriars Bobby, either a Skye Terrier or a Dandy Dinmont, I'm not quite sure. But for 14 whole years, wee Bobby the dog sat by his master's grave because Bobby was mourning. So dogs do have feelings. And I too want to congratulate the Honourable Member for North Ayrshire and Arran for a really thoughtful and compassionate leading of this debate, and for all the other members who have contributed so wisely and constructively and with such care and conviction. And I too pay tribute to the petitioners who have brought this vital issue to the Parliament's attention. And it's clear that across the House there is a consensus. The use of dogs in scientific testing raises profound ethical, scientific and societal questions. We've heard today that public concern about the welfare of animals used in experiments is growing. It's growing, and rightly so. As my colleague has referred earlier, my honourable friend, my party, our party, are proud and staunch supporters of high animal welfare standards. Throughout our history, we have championed the rights and well-being of animals, and this debate today is a contribution to that commitment. As my honourable friend pointed out earlier, let us not forget that during the coalition government, we introduced a ban on animal testing for household products, a significant step that reflected the public's desire for greater compassion in our laws. And in passing, Ms Jardine, I must say that we were strongly opposed to the unnecessary deaths of animals caused by what they call duplicated testing following this country's departure from the European Union. That was tragic and avoidable, a consequence that could and should have been prevented. And most recently, at my party's conference, This year, we reaffirmed our commitment by passing a substantial new policy motion, calling on the government to bring forward a comprehensive animal health and welfare bill as part of a proper national strategy to secure Britain's place as the world leader in animal welfare. It's not just about policy. Recognising, as I've said earlier, that animals are sentient beings in British law is essential. This isn't just a symbolic gesture. It places, I believe, a binding duty on governments now and in the future to uphold our country's high welfare standards. So let's be clear. Testing must be minimised wherever possible on dogs, rigorously justified, tightly regulated, and above all, actively reduced, day by day, week by week, month by month. That's why my party is calling for significant, sustained funding of research into alternative methods that are both more humane and scientifically advanced. And we have heard some interesting contributions as to how that can be taken forward. And I thank members from across the House for their thoughtful and constructive contributions. And I want to close by just referring to an old friend of mine. I was a scrawny wee boy. I was an only kid until I was 10, living on a small dairy farm in the north of Scotland. And my best friend was Gus. And Gus was an African lion hound. Sounds a very grand name. He was an enormous dog, Gus. But I was just a lonely wee boy on a farm, and Gus was my best chum. And, you know, we did everything together, Gus and me. I called him Gug because I couldn't pronounce Gus, mostly because my mum said I had a cold most of the time, because it was a very, very cold place. But Gus used to let, believe it or not, Gus, this vast dog, used to let me share his dog biscuits. And I can remember quite enjoying dog biscuits. I don't think I better go further because my late mother could be accused of bad parenting or rural deprivation. So I guess I was delighted to join this debate just to remember an old friend who was part of my earliest years and who's still remembered by me as a sweet and lovely dog. Thank you very much.
Opposition spokesperson Ben Obezi-Jekti.
Thank you, Mr Jardine, and it is a pleasure to serve under your chairmanship. May I also thank the almost 235,000 signatories to this petition, including 670 from my own constituency of Huntingdon, and to the member for North Ayrshire and Arran for bringing this important debate forward on behalf of the Petitions Committee. The number of signatories to this petition, the speed at which they were collated, demonstrates the strength of feeling on this issue, and is indeed just over a year since the previous debates on this topic. Before I start, I must also declare my interest as an officer of the All-Party Parliamentary Group on phasing out animal experiments in medical research, and also to declare my interest as the owner of the best-looking dog, since that we're all pitching for our various hounds. She is the winner, though, of several Best Rescue rosettes, so I think that puts that discussion to bed. Mr Chairman, the use of dogs and animals more broadly in scientific and regulatory procedures has long been a controversial and emotive topic. It is a topic that I have a closer interest in than I would maybe like, and also more than most members of this House need to. My constituency of Huntingdon has long been ground zero for much of the conversation around this practice, and has two sites involved in pharmaceutical research and animal testing, chiefly LabCorp as a pharmaceutical testing facility, and also Marshall Bioresources via their beagle breeding facility known as MBR Acres. As such, I speak on this subject with some first-hand experience of its sensitivity. Only this weekend, we had a large demonstration outside MBR Acres. That saw several hundred people there to demonstrate outside the beagle breeding facility. And also, I visited LabCorp last summer, so I've seen firsthand the lab conditions and the dogs within their pens, how they're looked after. Very sanitised, as you might expect. I didn't witness any of the experiments taking place, but it is a difficult thing to go and see the dogs held within those areas, knowing what awaits them on the testing process. But may I also add that whilst this debate is about dogs, they sit within a hierarchy where pigs are at the bottom of that hierarchy, then dogs, and then above them sit primates. And having visited that facility and seen the macaques that are used for testing above dogs, in rarer circumstances indeed, but it is notable, no one here has mentioned the use of primates within testing, but that is worth adding into this conversation, because having seen those and the way that they come over and climb on the fences and look at you in the eyes, there is obviously that similarity between humans and primates that makes it even more difficult to look at them than it is to look at the dogs themselves. I would like to make clear that I do not support animal testing for human medication, hence my APPG membership, but I do recognise it is at present still a crucial milestone that regrettably still has a place in the preclinical testing process until such time that there has been sufficient advancement within non-animal methods to see such practices no longer required across the board. I'm sure that I echo the sentiments of all members when I say we would like to see a world in which animal testing for human medication is no longer needed. Indeed, this is also the view of many we have spoken to involved in the testing itself. Animal research in the UK is regulated by the Home Office under the Animals Scientific Procedures Act of 1986. Under this legislation, the use of animals in research is prohibited if there is a non-animal method available that could be used instead. Therefore, animals can only be used in research when there are no alternative methods available. The opposition fully supports this act and its full enforcement. The previous government invested heavily into 3Rs funding, replacement of the use of animals where it is not necessary for research, reduction in the use of animals, and refinement to eliminate or reduce distress to the animals involved. Via the National Centre for 3Rs, or NC3RS, the previous government invested 90 million in research and a further 27 million in contracts through its Crack It Challenges Innovation Scheme for UK and EU-based institutions. Furthermore, the UKRI Biotechnology and Biological Sciences Council supports research aimed at developing and applying innovative methods to study human and animal physiology, including in silico approaches, organ-on-a-chip, and organoid and other advanced cell culture systems. Last year, the previous Minister of State for Science, Research and Innovation, my honourable friend, the member for Arundel and South Downs, announced a doubling of the annual funding to £20 million. He also announced that the last government had a plan to accelerate the development, validation and uptake of technologies and methods to reduce reliance on the use of animals in science. I wrote to the Science Minister last year and asked him whether he would be publishing this plan. So I would be keen to hear from the Minister what happened to this plan and when the government's version can be expected. As we're all well aware, as part of its election manifesto last year, the Labour government pledged to phase out animal testing, with its starting position being that it is not yet possible to replace all animal use due to the complexity of biological systems and regulatory requirements for their use. Whilst we would share the government's ambition to phase out the use of animals in the testing process, it is simply not realistic to do so with the immediacy that is often clamoured for by those protesting against the process. The medical industry is in desperate need of further investment to see new alternatives realised. Currently, the medical industry does not have the resources to stop animal testing with immediate effect in a way that would ensure sufficient safety of certain medicines or in a way which would be compliant with many foreign market standards and regulatory frameworks. Global medicines regulators, including the UK's Medicines and Healthcare Products Regulatory Agency, the MHRA, and the US Food and Drug Administration, the FDA, require stringent research standards are met regarding the safety of a potential new medicine before it is used in human clinical trials. In February, I asked the government what discussions they had had with the US Food and Drug Administration, the European Medicines Agency and Swissmedic regarding the regulatory approval of non-animal methods. The government is working to understand the international drivers and challenges to integrating non-animal methods into regulatory safety testing. This includes engaging with government, scientists and regulators, including the Medicines and Healthcare Products Regulatory Agency, Food Standards Agency and Environment Agency, as well as international medicines and chemicals regulators. Separately, the Minister has informed me that they will need to be incorporated into international regulatory guidelines which the MHRA adhere to. That's it. That's the government's entire approach to crossing the enormous hurdle of international recognition. Irrespective of how much money we pour into research, without international recognition of specific non-animal methods for each pharmaceutical product tested via those means, the international licensing of those products simply isn't feasible. And so any talk from the government regarding phasing out animal testing is just lip service in that regard. In September, I asked the government what steps they are taking to change International Council for Harmonisation of Technical Requirements for Pharmaceuticals for Human Use policy to allow results from non-animal methods of pharmaceutical testing to be used to support drug safety through preclinical trials. Their response was that we are engaging with the Medicines and Healthcare Products Regulatory Agency, who represent the UK at the International Council for Harmonisation of Technical Requirements for Pharmaceuticals for Human Use, on how to accelerate the acceptance of data generated in non-animal methods for drug safety decision-making. I'm aware that the MHRA attended a ministerial roundtable on accelerating the adoption of alternatives to using animals for drug development last year. Given that was over 6 months ago, I would be keen to hear from the Minister about the subsequent progress that has been made. We need action from the government in a number of areas if they are to meet their ambition of animal-free testing. We would welcome clarification from the Minister of what has been done and what further will be done in relation to conversations with other regulatory bodies and governments to see the phasing out of animal testing as a priority and one which will not hinder trade possibilities when alternatives are available. As the government works further on trade deals, it is crucial where medicines are concerned that this area is looked at closely as an area where the UK can lead the way. Working with partners on this is a key for our scientific and medical industry going forward, as even where we might have alternatives not tested on animals, some products would not fit the criteria to sell elsewhere given the current rules. In February, I asked the Minister for Data Protection if the government will publish a timeline of what tests will be phased out via the work of the NC3Rs and when. His response was that we are working at pace, trying to put together a practicable policy and strategy, which, as I said, we will publish by the end of the year. I'm aware that the government has already made clear that it will publish a strategy to support the development, validation, uptake of alternative methods later this year. And whilst I do not anticipate that the situation has changed significantly in the 10 weeks since that exchange, I would like to hear from the Minister as to whether progress has been made now that we're a third of the way through the year. Is a strategy now in place? Furthermore, could the Minister expand on what engagement exactly is the Department and Government at large having with the pharmaceutical industry and regulatory authorities on how to take their commitment forward? The issue of licences for animal testing is also one which should be addressed, though I appreciate it is not within the scope of this department's brief. Marshall Bioresources in my constituency last received an unannounced inspection from the Animals and Science Regulation Unit, the ASRU, in April 2024, and since receiving their establishment licence in October 2017, have received 8 announced and 7 unannounced inspections. The outcome of the most recent inspection was that there were no critical, major or minor findings and no low-level concerns identified. With that in mind, the Minister has previously informed me that the Government is preparing to conduct an internal review in relation to the duration of project licences for animal research under the Animal Scientific Procedures Act 1986. The original schedule was for that report on the review to be published by the end of 2025, so could she tell me whether the review has started and whether the report will still be published by year end? To conclude, we want to see clear, pragmatic plans that support this Government's manifesto pledges, and this must be done in a way that sees viable alternative testing methods which are safe and can sell on the international stage. Thank you.
Okay. Minister Clark.
Thank you, Ms Jardine, and it's a pleasure to serve under your chairmanship. Can I start by thanking my honourable friend, the member for North Ayrshire and Arran, for opening the today's important debate, and also thank the thousands of petitioners some of whom are here today, which indicates the strength of public views on this matter. And I thank all our honourable and right honourable friends who've made powerful contributions today. I don't have dogs, so I'm not going to enter the competition about whose dog is the cutest, but I do have 2 little children who touch and try to touch every single dog that we come across when we go around in parks, but they at least now know that they have to ask permission before they do that, and I feel that I'm not too far away from having one of those cute, or someone like Frank in our household very soon. Ms Sheldon, the government and I fully appreciate that the use of dogs for scientific and regulatory procedures stirs strong emotional feelings, and for many people across the UK, including for myself as a dog lover. I, in my previous role, when I was in local government, was responsible for environment and also including stray dogs, and did the service for many of the authorities around us. And in a bid to avoid having to put dogs, healthy dogs down, we set up London's first dog hotel, which Peter Egan opened, and had systems where we had the service where the staff could come and take dogs out for walks. So I've had, in every role I've had to, it's been looking after dogs. I found this preparation for this debate very difficult, I must say. I also, along with members here, long for the day when we can finally bring an end to animal testing and the use of dogs in scientific research, a day that cannot come soon enough. Sadly, that is not here yet, that's not today. The UK is world leading in development of non-animal methods, and the government is keen to ensure that they are utilised wherever possible. That's why our manifesto commits us to partner with scientists, industry and civil society as we work towards the phasing out of animal testing. Colleagues mentioned the changes that the FDA have brought forward, and just to make clear that the FDA changes broadly bring them in line with us, and this is around regarding protection of animals. So if where there is new learning to be done, we absolutely will be looking at that. And indeed, Ms Jardine, as part of our commitment to phasing out the use of animals in science, we will publish a strategy to support the development, validation and uptake of alternative methods. This will set out how we can build on our support for alternative methods by creating a research and innovation system that replaces animals with alternative methods wherever possible. However, for now, the carefully regulated use of animals, including dogs, in scientific research remains necessary to protect humans and the wider environment. I will now expand on why, given that the current state of science, we are unfortunately not yet ready to ban the use of dogs for testing and research purposes in the UK. The use of animals in science lies in the intersection of two vital public goods: the benefits to humans, animals and the environment, and the UK's proud history of support for the highest possible standards of animal welfare. The balance between these two public goods is reflected in the UK's robust regulation of the use of animals in science through Animal Scientific Procedures Act 1986, known as ASPR. This Act specifies that animals can only be used in science for specific limited purposes where there are no alternatives, where the number of animals used is the minimum needed to achieve the scientific benefit, and where the potential harm to animals is limited to the absolute minimum, as it's been referred to, known as the 3 Rs: replacement, reduction and refinement. The use of animals in science is therefore highly regulated, including a 3-tier system of licensing which licenses each establishment, project and individual involved in performing regulated procedures involving animals. All establishments are required to have dedicated individuals, including veterinary surgeons with legal responsibilities for the care and welfare of animals, and an ethical review body which reviews any proposals for the use of animals and promotes the 3 Rs of animal use. Our manifesto commitment stands in recognition that the phasing out of animal testing has to be in lockstep with the development of alternatives. As yet, the reality is that the technology is not yet advanced enough for alternative methods to completely replace the use of animals. For now, animal testing and research plays an important role in supporting the development of new medicines and cutting-edge medical technologies for humans and animals, and it supports the safety and sustainability of our environment. Animal research has helped us make life-changing discoveries, from new vaccines and medicines to transplant procedures, anaesthetic and blood transfusions. The development of the COVID-19 vaccine, as with all vaccines, was only made possible because of the use of animals in research. Animals are used to assess how potential new medicines affect biological systems, ensuring drugs are safe and effective before human trials. Many products which would be unsafe or ineffective or could cause harm to humans are detected through animal testing, ensuring the safety of healthy volunteers who take part in clinical trial, as well as future patients. Of course.
I thank the Minister for giving way. We've heard from a number of members today about the serious doubts around the efficacy of some of these tests that you're referring to. Some of them very learned members of Parliament who have professional backgrounds in this area. So would the Minister be willing to share with me after the debate the sources that she's using to support the claims that she's making regarding the value of this testing?
Thank you, Mr. Jordan. Thank him for that intervention. Happy to share the research and the reasons behind my arguments. As I said, animal testing is therefore required by international agreement, which all global medicines regulators, including the UK's Medicine and Healthcare Products Regulatory Agency, MHRA, follow. Although the MHRA does not require all medicines to be tested on 2 species, safety testing in a second species is required for most drugs, with dogs being one of the species that can be used. The key proposal in the petition calls for the immediate ban of the use of dogs in scientific and regulatory procedures. None of us, Ms. Sheridan, none of us want dogs to be used in research, despite how carefully animal welfare is regulated. However, I do regret to say that forbidding the use of dogs in medical research without alternatives at the moment will likely have catastrophic effects on the UK's medical research system. We will be unable to meet international regulatory requirements for drug safety testing, preventing virtually all first-in-human trials in the UK and vastly reducing the number of subsequent clinical trials. A significant proportion of basic research would cease, preventing new insight into disease and treatment that saves lives and improves people's health. Finally, forbidding the use of animals in medical research would likely have a negative impact on animal welfare as well. Animal testing will move overseas to countries where the regulations on the use of animals in science are less stringent than they are here. I am proud to say that the UK is world leading in the development of alternative methods, and we are keen to utilise this technology as much as possible, as much as we can. We are striving to partner with regulators to see how advances in technology can phase out animal use where we are able. I will give way.
She's making an interesting speech because our manifesto commitment is very clear. The Labour Party commitment is we're looking to ban animal testing. So we've talked about a roadmap which Labour has committed to. So when will that be published, and when will the strategy actually be published? Because these are vital things that people in this gallery want to know today.
Minister Clark.
Thank you, Madam Speaker. The Honourable Lady makes an intervention at the right time. As I was just about to say, in publishing our roadmap, we will be setting out how we can go even further in supporting alternative methods, working towards a world where the use of animals in science is eliminated in all but exceptional circumstances. This will be achieved by creating a research and innovation system that replaces animals with alternatives wherever possible. Currently, for UKRI, this government supports the development and dissemination of their 3 Rs. This is achieved primarily through funding of the National Centre for 3 Rs, which works nationally and internationally to drive the uptake of alternative technologies and to ensure that advances are reflected in policy and regulation practices and regulation of animal research. I wanted to say, of course.
Thank you. I failed to catch you on the previous mention of 3 Rs, and thank you for taking the intervention. Does the Minister agree that over the recent years the number of procedures using specially protected species, cats, dogs, horses, non-human primates, has actually increased to around 17,000 from about 15,000 in 2022, and that was driven by a 38.9% rise in procedures using horses, and that the Home Office Minister, Dan Jarvis, confirmed that from 1st of January 23 to 30th September 24, no applications for a project licence under the Animals Act has been refused. And so does the Minister see that there are reductions in animals being used in animal testing, or in fact actually as part of this strategy actually are they increasing? Thank you.
Thank you. I thank Honourable Friend for that intervention. The stats that I have, it says that the testing in animals has reduced by 9%. In 2020, the use of dogs in procedures are reduced by 9%. Overall animal testing, I will have to get back to him on. And I'm sure my colleagues from Home Office will be able to explain the stringent licensing procedure that everyone has to go through to be able to obtain a licence. In conclusion, Ms Sheridan, we want to replace the use of animals in scientific procedures with alternatives where we can. That is why our current approach is to support and fund the development and dissemination of techniques that replace, reduce and refine the use of animals in research, and to ensure that the UK has a robust regulatory system for licensing animal studies and enforcing legal standards which will drive their uptake. We have a commitment in our manifesto to do all we can to phase out the use of animals in science, including the use of dogs, and we will be publishing a roadmap before the end of the year to lay out how we can give increased impetus to the support and validation of alternative medicines. Colleagues asked about ensuring that we are consulting animal welfare organisations. Just to say that there is a meeting, there is a roundtable meeting with the Office of Life Science and organisations, animal welfare organisations, to actually go through precisely that. And the Honourable Member for Winchester requested a meeting to discuss the issues around the benefits of testing on animals. I'm happy to agree to that, and I will be in contact with his office to arrange a meeting, such meeting. Finally, Ms Sheridan, I would like to conclude by thanking members once again for the insightful contributions to today's debate, and I look forward to working together going forward.
Thank you. Irene Campbell to wind up.
Thank you. So firstly, I would like to thank Maria Iriat for her work in growing this petition to over 235,000 signatures. And thank you to the supporters who have attended today's debate. It's much appreciated. I'd also like to thank Animal Free Research, Cruelty Free International, Dr. Jared Bailey and Understanding Animal Research for their helpful briefings. So as ever, many thanks, a huge thanks to the staff in the Petitions Committee for their invaluable hard work and organisation in preparing meetings, briefings and the support given to me to prepare today's debate. So Britain is undoubtedly a nation of animal lovers, as we've heard today. And as a Scottish MP, I've got some Scottish data to hand. So 79% of Scottish adults believe that it's unacceptable for experiments in animals to continue when other testing methods are available. And 62% were in favour of the government setting deadlines for the phasing out of animal testing. And in my own constituency, 248 people signed this petition. And I think the timeline is crucial to this. I really do. I think that we will get a roadmap, but I think if we're getting a roadmap, we need to have a realistic timeline with the roadmap. I think if there's no timeline with the roadmap, then I think that's hugely problematic. I have to be honest, I think today's debate has brought attention to an issue that many people do not want to face or discuss, and today's many contributions highlight the depth of feeling in relation to this matter. However, we really have scientific evidence and many scientists supporting and advising that it is time to remove dogs from medical testing. I think it's important to remember, although we have mentioned animal testing in its wider sense, this debate is about removing dogs immediately from testing, and I think we shouldn't lose sight of that. I mean, Jenny the dog's here today. We obviously have a dog in the chamber, and I actually think it's really important that we remember that the focus is today on removing dogs from medical testing. I'd very much like to thank everyone who's taken part today, and the Minister for her, I've got to say, disappointing response. And I look forward to the day that we do achieve this aim, and I really do think we have to have a timeline, or the roadmap, in my view, isn't robust. Thank you.
The question is that this House has considered E-petition 705384 relating to the use of dogs in scientific and regulatory procedures. As many are as of that opinion say aye. Aye. Of the contrary, no. I think the ayes have it. Order, order.